Let's examine the major landmarks of the humerus. The humerus is the only bone located between the shoulder and the elbow. This is the humerus. One end of the humerus has a rounded ball shape. This is the proximal end, the part that forms the shoulder joint. The round, ball-shaped structure is the head of the humerus. Next to the head are two bumps called tubercles. The greater tubercle is slightly superior to the lesser tubercle. Between the greater tubercle and the lesser tubercle is the intertubercular sulcus. Between the head of the humerus and the tubercles is the anatomical neck. Between the epiphysis, which is the rounded end of the bone, and the diaphysis, which is the shaft of the bone, is the surgical neck of the humerus. The head of the humerus is medial and the tubercles are lateral. When looking at the lateral surface of the diaphysis, we can see an elevated ridge. This ridge is the deltoid tuberosity. The inferior end of the bone, which helps form the elbow joint, looks somewhat like a fist with a thumb sticking out. The surface with a shallow depression is the anterior surface. The other surface has a deep depression. This is the posterior surface. Let's start with the anterior surface, where we see this small thumb-like projection called the medial epicondyle. Next to the medial epicondyle is a wedge-shaped projection called the trochlea. Next to the trochlea is a round ball called the capitulum. Next to the capitulum is a slight elevation called the lateral epicondyle. The shallow depression on the anterior surface of the humerus is the coronoid fossa. The deep depression on the posterior surface of the humerus is the olecranon fossa. Let's finish by reviewing the major landmarks of the humerus. Humerus. Head. Greater tubercle. Lesser tubercle. Intertubercular sulcus. Anatomical neck. Surgical neck. Deltoid tuberosity. Medial epicondyle. Trochlea. Capitulum. Lateral epicondyle. Coronoid fossa.